Hey guys, so for this week, I'm going to be looking at an article that was published by Deng et al. In 2022 in the Journal of Science and Medicine and Sport. Um, it's called An Isometric Neck Strengthening Program Does Not Improve Neck Strength in Elite Women's Football Code Athletes. And it was an RCT. So it was published really recently, which is good. So just a brief overview, the population they're looking at was female athletes, and it was soccer and Australian rules football players. So it was all professional female athletes. So the average age was about 25, give or take a few years. Obviously, they're all elite athletes with at least 3 to 4 years of professional experience. So the inclusion criteria was no history of head injury, and they had to be at least 18 years old. The intervention they were looking at for this, as suggested by the title, was a neck strengthening program done over 12 weeks. So what they did in this study was having a control group that did the standard strength conditioning routine that was provided to all the other athletes. And then the control group or the intervention group did the neck strengthening program plus the regular strength conditioning program for 12 weeks. So the demographics was, like I said, adult professional athletes. There's 10 soccer players and then 20 Australian football players at the professional level again. So the goal of the study was really just to see if neck strengthening programs worked. They tested isometric neck strength. Some other studies have tested concentric, eccentric, but this study just looked at isometric neck strength, and they evaluated their strength levels pre, during, and post season. So statistical analysis for this was done with a mixed design ANOVA. Independent t-tests were used to identify differences in baseline info like age and height, weight differences, things that were going to vary across the population. Like I said, the ANOVA was for the dependent variables. In this case was absolute neck strength and neck circumference pre, mid, post study. And the significance level was set to less than 0.05. So what they found was pretty interesting. They found that absolute neck strength along with head to neck circumference ratio and neck circumference showed no group by time interactions and no between group effects. So overall, they found really that the neck strengthening group did not have a greater increase in specific neck strength as compared to the control group. So when it says that significant changes were found for head to neck circumference and neck strength and neck circumference, that really just means that overall the standard strength conditioning program was effective in improving neck strength non-specifically. So basically doing all the regular weightlifting by secondary effect increased neck strength, which is something that would make sense for most, because certain exercises are going to activate the neck muscles and to work neck musculature, like through the traps, for instance. And plus they're just testing isometric neck strength. So just peak contraction, which in a lot of cases could be benefited by trunk strength, which would be increased in a standard strength conditioning program anyways. So overall, no difference in neck strength was found between the control group and the intervention group. So in this, neck strengthening was not effective in the study, specifically in this female sporting population. So suggests that maybe the intervention would not be applicable across all populations or in all athletes. The clinical bottom line, I have to say, is a bit two-sided, because there are some critiques I have of this study, specifically in the design. What they did for the actual neck strengthening program, I don't think was a very valid way of increasing strength, because they only did isometric exercises where they, just performed a peak contraction for a certain limit of time, and they never changed resistance levels. So there was no need for progressive overload of the neck muscles, which means that they're not going to get stronger if they're just going to keep doing the same force each and every time for the 12 weeks. So that was my main problem with the study, is just the application of the program was not very good. They could have definitely done better with how they implemented the exercise for strengthening, which other studies have done, say, more concentric, eccentric action, and they've progressively increased resistance and, using different bands and such. So this study could definitely be done differently in the future, I think. Also, the demographic is only female. Obviously, if we wanted to see all population, we'd have to include males as well. And also the time for the intervention application was pretty short. It was only 12 weeks. Most other studies I see like this, they're usually looking at a 16-week time span. And obviously, to think about the extra difference that a month can make is pretty significant. So if I were to do the study again, I would probably include another 4 weeks to the intervention group. And that's everything. Thank you.